Ladies and gentlemen, my name is Dr. Faraj Edher, and welcome to my informative webinar on restoring missing teeth. Now, the reason I conduct these webinars is I believe that you deserve all of the information that you need to make the best decisions related to your oral and dental health. This webinar will be around 20 minutes, and we'll talk about all of the different options involved in replacing and restoring missing teeth, whether that be one tooth that you're missing or a tooth that you know is going to have to come out. What can we do to give you that tooth back? What are the different options and the risks and benefits of each of those options? We'll also talk about if you're missing multiple teeth or even missing all of your teeth, and what are the things that we can do to give you back a beautiful smile and teeth that you're happy and comfortable, eating and chewing and smiling and talking with. So before we get started, like I said, my name is Dr. Faraj Edher, and I'm a dental specialist in prosthodontics. So I'm called a prosthodontist. And what a prosthodontist is a dentist that spends an additional 3 years after dental school getting advanced training in restorative and prosthetic dentistry. So things like implants and dentures and crowns and bridges and cosmetic dentistry. I am the director of the Digital Dentistry Institute, which is a global education institute where we conduct training to dentists, hundreds and hundreds of dentists across the world on dental implants and digital technology in dentistry. I teach part-time at the University of British Columbia as a clinical assistant professor and a guest lecturer, and I'm also a fellow of the Royal College of Dental Surgeons of Canada. So I practice in Vancouver, Coquitlam, and Prince George, British Columbia. This is our office in Vancouver called BC Perio. We have a beautiful office with a beautiful, beautiful view, especially on a beautiful day like this. But most importantly, it's a special office because we utilize some of the most advanced digital technology in the world, like cone beam CTs and intraoral scanners, milling machines, virtual smile design, all of these tools that allow us to provide our patients with predictable, effective, and high-quality dentistry. Now, let me note that this webinar will discuss general information and answer some of the common questions I get day to day from my patients. It's not intended to be medical or dental advice, and you still need to come and see me or go to your dentist for an examination and a consultation in order for us to determine the right dental treatment for you. So let's get started and talk about if you're missing one tooth or a few teeth in your mouth. What are your different options? So this young lady, for example, who came in to see me, she was missing one of her front teeth for a few years and wanted to have something permanent placed that she doesn't have to worry about. So what are her different options? What can be done to give her that tooth back? That's what we'll be talking about. Now, one option is to do nothing and just keep the space, right? In her case, that's not an option because it's a front tooth and it's something that she wants addressed. But what are the problems? Let's say you're missing a back tooth. Do you really need to replace it? And the answer is you don't need to do anything if you don't want to do it, but there are risks involved in having a tooth that's missing and not filling the space with a tooth. And that risk is that other teeth can start to move into that space, which can start to lead to bite issues and other complications. Missing teeth can also affect your chewing ability, and of course, like we said, if it's a front tooth, then it's a cosmetic or aesthetic concern. So, one of the options that's there to replace a missing tooth is a removable denture. So a removable denture, or what's sometimes called a flipper, is something that you can flip in and out of your mouth. It's removable and it replaces one or many teeth. The advantages of this is that it's the least expensive and fastest solution. That being said, it's inconvenient to have something that you have to remove and place every day, something that moves when you talk and when you chew, if you're only replacing one or just a few teeth. It can, however, be a good temporary solution or a provisional solution as we complete, more definitive and more permanent long-term treatment. Another option is what's called a dental bridge. So in this photo here, you can see someone's missing a tooth A bridge utilizes the two teeth on either side of the space. They're prepared by grinding them down slightly in order for them to have a crown that sits on top of them, but instead of it being a single individual crown, the teeth are connected to each other as one unit, which is called a bridge, and that unit also replaces the missing tooth that's there. So what we do is, there's a missing tooth, we prepare the two teeth on either side of that space, and then we create a bridge that sits on the two teeth on either side of the place and allows us to restore that missing space. The advantages of a bridge are that it's fast. It can usually be done within 2 to 3 weeks. It's less expensive in some cases compared to implants, but keep in mind that that's just a short-term comparison. In the long term, implants can a lot of times actually end up being more affordable than having a bridge done. But bridges also can provide good results if they're done well and they're maintained well. The disadvantage of a bridge is we're having to grind down the teeth next to the space that may not necessarily need any work done on them. The entire bridge is also one unit, which means down the line, if anything happens, you're having to deal with that entire bridge at a time, as opposed to dealing with a single tooth at a time. As you can imagine, because the bridge is splinted or connected, you can't get floss in between those three teeth, which means that it can be slightly more difficult to clean than solutions that provide you with individual teeth that you can floss in between. So the last option for replacing a missing tooth is a dental implant, and a dental implant replaces the tooth on its own without having to do any work to the adjacent teeth or the teeth next to the space. So going back to that case I initially showed you, this young lady missing that front tooth, we're able to place an implant. You can see the implant sticking out of the gums there, and this is a pretty straightforward surgical procedure. I like to compare it to having a tooth pulled. Actually, a lot of patients say that having an implant placed is more comfortable or less, invasive and uncomfortable than having a tooth pulled. And after that implant is placed, we can put a tooth on it. So you can see here we've achieved very beautiful natural results where it's very hard to tell that there's any work that's been done at all. The advantages of an implant are that they don't damage or have any work done to the adjacent teeth. It's an individual tooth, which means you can floss between the teeth and it's easier for you to clean. And an implant, as opposed to a bridge or a removable denture, actually preserves the jawbone. When there's no tooth or implant in a site, what happens is that the jawbone and the gums start to shrink in that area, which makes it more difficult to place an implant in the future. And just like bridges and other options, they've been shown to do very well long term if they're done well and maintained well. The disadvantage of an implant is that it can in some cases take longer to complete, because we do let the implant heal for around 3 months before we put the final tooth on there, but very often we're able to put a temporary tooth on the implant on the same day, especially if it's a front tooth where it's a aesthetic concern. They can also be more expensive when compared to a removable denture, and in the short term they can be more expensive than a bridge, but like I said, given the complications that can sometimes happen with bridges, implants in the long term could turn out to actually be less expensive than a bridge. Because the implants go into your jawbone or into your gums to replace the missing part of the tooth or the root of the tooth, if you've had that tooth missing for a long time, in some situations we may need to build up the bone so we have the right amount of space to place an implant that can do well long term. So this gentleman came in to see me a couple weeks before Christmas. He had fell off his ladder putting up lights and broke his front tooth. So again, we wanted to give him a tooth before the holidays, so what we were able to do is remove the tooth, put an implant in, and give him a temporary tooth all on the same day, And then after the holidays, 3 months later, we were able to replace the temporary tooth with a final tooth, and we were able to get very nice, natural looking results, giving him his tooth back. So what if you're missing many teeth, not just a single tooth that's missing? Now, we know that teeth are a very important part of our smile and our overall appearance. So what are your options if you're missing many teeth, or let's say all of your teeth? So like this gentleman who came in to see me, he had problems with his teeth for many, many years, and we can see here that he's had gum recession, discoloration, and all of his upper teeth had to go. So because of all of his upper teeth had to go, what are the options for us to replace all teeth? Dentures is one option, which is something you might have heard of as a plate. Dentures are removable, and they replace all of the missing teeth in an arch. So they either replace all the upper teeth or all the lower teeth, or we can have upper and lower dentures that replace all the teeth. The advantage of dentures is that they're the most affordable option to replace all the teeth, and usually there's no additional surgery that's required. The major disadvantages of complete removable dentures is that they're removable, which means that your teeth move. They move slightly when you talk, they move slightly when you're chewing your food, and you have to remove them every day to clean them. The other thing that happens, because there are no teeth or implants in the jawbone changes over time and starts to shrink, which means that dentures within a couple of years won't fit as well as they used to, and then they need to be relined or remade in some cases. Another thing to be aware of with dentures that a lot of people find uncomfortable sometimes is that they cover the roof of the mouth, and that can affect how you taste your food and sometimes how your tongue moves when you speak. Another important thing is to understand that not all dentures are created equal. So this is an example of a patient that came to see me with an upper denture that she was unhappy with. You can see that it doesn't look very natural and just looks very denture-like, and we were able to replace it with this new denture that looks a lot more natural and gives her back a beautiful smile, even though it is a removable denture. Now, another option is utilizing dental implants to hold that denture in place. Like we said, the main disadvantage of dentures is that they're movable and removable. Now, if we're able to place implants that the denture clips on and off of, that significantly improves the retention and the stability of the denture. So the advantage is that it gives you more stable dentures. There's less movement when chewing or talking. They can be designed in some cases to not cover the roof of your mouth, and because they're removable, they're still easy to remove and keep clean. The disadvantage is that you do have to remove them still and clean them at least twice a day, and it takes more time to complete than just traditional complete dentures because of the fact that we're placing implants. And because we're placing implants, that means that they're more expensive than the conventional removable dentures that don't have implants supporting them. So going back to this gentleman where all of his upper teeth had to come out, we were able to remove all his upper teeth, place implants, and give him a denture that holds onto the implants so he has a beautiful smile. You can see the huge difference that this has created for him, where he now has a beautiful smile that's comfortable. The denture doesn't move because it's held on with implants, and he can chew and talk and smile better than he has in many, many years. We're also able to utilize dental implants and fix teeth to those implants. That means that the teeth cannot come out unless you're in a dental office because the teeth are actually screwed into the implants. And the advantage of that option is that the teeth are permanently fixed. You don't have to worry about them moving. You don't have to worry about removing them. There's no movement when you're chewing or talking. It's the closest feeling to real teeth compared to all those options we talked about. So there's more ease of mind, and it doesn't cover the roof of your mouth. The disadvantage is, like we said, because we're using implants, the treatment from start to finish takes longer to complete, And because they're fixed, you can't remove the teeth and clean them. You have to clean them in your mouth, which requires a little bit more effort from you. But what we do is we spend the time to explain and educate you, give you all the tools that you need to ensure that you can keep these things as clean as possible. Because regardless of what option you end up doing, whether it's for all your teeth or a single missing tooth, keeping things clean is a key to long-term success. Now, these dental implant fix solutions are more expensive than the other solutions because they do require more work to get them done. This is an example again of a patient who had to have all of his upper and lower teeth removed, and we were able to replace all of his upper and his lower teeth with dental implants and fixed teeth that feel like they're natural teeth, or as close as possible to natural teeth. They look good, and he doesn't have to worry about removing them, and he can chew and eat normally with them. So what are some of the things that you should look for when you're looking to have missing teeth restored, whether it's with dentures or bridges or dental implants? One thing you should be mindful of is seeing someone who has the skill sets and experience to give you the treatment that you need. I believe attention to detail is very important because it's the details that make the difference between good results and excellent results. Technology is a very useful thing in today's world. We have some of the most advanced technology that really allows us to do things with computer-aided precision. We place our implants after having planned them on the computer using surgical guides so that they're placed precisely to the millimeter. And that's really important for us to achieve the high quality results that we want. The quality of the work being done is really important, and the aesthetic quality is important too. So just like with anything else, an eye for detail and an eye for beauty is important to allow you to have a smile that is natural and beautiful and healthy. I think it's important that your dentist spends the right amount of time in the chair with you to understand your expectations and concerns and go over all the different options with you so you make sure you're making the right decision for your oral and dental health. The quality of the materials being used is important, which is why we have an in-house lab in our Vancouver office that allows us to be able to control the quality at every step of the process when making your new tooth or your new teeth. Also, your overall comfort and the overall experience that you have with your dentist and in that dental office. You want to make sure you're happy to be there, you like the dentist that's working with you, and that you're happy being at the clinic that you're in. Another important thing is making sure that there are no hidden fees. You have to understand that especially with dental implants, there's a lot of components that are involved. There's the actual implant, and then there's the crown that's on the implant, there's abutments, and there's screws. What we do is during the consultation appointment, when we go over all of your x-rays and we do the examination, we decide on a treatment plan, we give you an estimate for that treatment plan that includes everything from start to finish, so there are no surprises along the way. So for the last couple minutes of this presentation, I'd like to walk you through the consultation process if you choose to come and see me for a consultation regarding restoring a missing tooth or missing teeth. So what you can expect is you'll show up to our clinic. This is our clinic in Vancouver. Like I said, I practice in Vancouver, Coquitlam, and Prince George. This is the clinic that we have in Vancouver. BC Perio is the name of the clinic. You'll be greeted by one of the dental assistants. This is Courtney. She's the assistant I work with in Vancouver and Coquitlam. She'll ask you a few questions and get you comfortable, and then I'll come in and we'll have a discussion. I'll get a really good understanding of your concerns and your expectations. I'll do an examination, we'll check everything, and we'll talk about your different options. We may even take some photographs, because what we can do is we can start planning using the technology that we have in order to have a really good idea of what we want our final outcomes to be. So during that consultation appointment, you'll have the examination. I'll get an understanding of your concerns and expectations. We'll discuss all the different options. We'll go over timelines and costs, and we'll decide on a treatment plan moving forward. So again, thank you very much for attending my webinar. I hope that you found this helpful. I hope it gives you information you need to make the best decision related to your oral health. If you have any questions, feel free to visit my website, www.drfarajedher.com. You can also find me on social media at Dr. Faraj Edher. You'll see on the screen here the numbers for our Vancouver, Coquitlam, and Prince George offices. If you'd like to see me for a consultation, you can give any of these offices a call, ask them for a consultation with Dr. Edher. You'll come in, we'll have a chat, I'll do an examination, we'll talk about all your different options, we'll talk about what can and can't be done, and we'll figure out a plan that's going to work for you in order to give you a healthy, beautiful smile, whether you're missing one tooth or multiple teeth. So again, thank you very much. Please feel free to reach out to me if you have any further questions, and I hope to see you soon.